Hi students, and welcome to PATH. My name is Sigifredo Perez, and I'm the lead sports physical therapist here at DHR Health Orthopedic Sports Therapy Institute. As far as how long it took me to become a physical therapist, it took me 5.5 years. Most people takes about 6 to 8 years, and when I was in high school, I had the opportunity to take college classes, and I took advantage of it. So you as students in high school should look up at the opportunities to take college classes, as many as you can, to get ahead of the game. As far as for me, in my undergrad, I went to UTPA, which is UTRGV now. It took me about 3 years to finish my bachelor program, and then I got accepted to the University of St. Augustine in Austin. And that program is an accelerated program, meaning you take more classes per semester. And so therefore it took me about 2.5 years. Some other physical therapy schools take about 3 to 4 years as far as the whole doctorate program. A day in my shoes, I see about 8 to 12 patients a day, depending on the volume. As a physical therapist, you're involved with evaluations, reevaluations, and even treatment visits. As far as the types of patients that I see, being the lead sports therapist, I'm more involved in the orthopedic and sports cases that we get on a daily basis. Some other professionals that we work with, we did have the addition of hand therapy. So we do see interactions with occupational therapists. Now we're seeing more neuro cases as well, so we do see more speech therapists coming in our way. Some other professionals that we work with are the orthopedic surgeons downstairs at the institute, because we're a 2-story building. So we're located on the top floor. So day to day, if I need to talk to an orthopedic surgeon or get in touch with them, I can just call them up downstairs. As a physical therapist, it's very important that you understand the human body and how it works inside and out when it comes to muscles, cardiovascular, neurological symptoms, and everything like that. In my case, being with the sports and ortho cases, I have to work on biomechanics, functional abilities, movement, make sure that patients understand proper movement so they're not hurting themselves anymore. I also deal with post-op procedures, so we get a lot of ACL tears, rotator cuff tears, ankle injuries, and everything like that. So understanding how the human body repairs itself after surgery is very important in my day-to-day activities. And lastly, being with the sports team, I do focus a lot on functional sports-specific training, so that way our athletes can get back to the field or the court in a timely manner. As you can see with all the photos that I've placed here, we are almost like a big gym, okay? And that's the exciting part of my day. The fun facts is that I get to work with athletes every day, all day. They can be high school athletes such as yourself, college athletes from UTRGV and other schools around Texas, and even professional athletes. I have worked with the Toros soccer team and the Vipers basketball team, as well as international athletes that come our way. We take care of all of them. Another fun fact is I get to build rapport with doctors all day, every day, which is a great opportunity, because a lot of times people can be hesitant to talk to doctors, and you realize that even treating doctors, they're awesome people, and they're just like you and me, and there's nothing to be intimidated by. And so having that rapport with them helps build an overall program for the patients that I get to ensure that they have the best outcome possible. And then lastly, as you can see, it's a sports-specific training facility, so it's awesome. We have all state-of-the-art facility, and we have all the machines that you can think of. We have an Alter-G, which is a zero-gravity treadmill when patients are ready to get back to running, but they can't run on land. We put them in there, it inflates, and it takes the pressure off their legs. We also have BFR training, which most people can see if they Google BFR. It's pretty much what it does is it decreases the blood flow back into the body, and it increases the healing time and increases the muscle size as well. So it's just a great overall environment to work at here at DHR. As far as helpful tips, I would say just volunteer and shadow with PTs. When I was in high school, I really didn't know what physical therapists did, and so I just assumed, oh, like they stretch people out or they heal people somehow. But being able to go out and shadow PTs is a great opportunity because you realize that it's not just the sports side of physical therapy that's awesome. There's also pediatric, there's geriatric, there's cardio, volunteer at a nursing home, just to see exactly what physical therapists do all day, every day. And to see if that's what you really want to do, okay? Because some people can say they want to be physical therapists and then they start getting into it and they realize it might not be for them. But just like I said, get the exposure for it so that way they can really learn what we do. Another thing is research the profession itself. Like I said, some people think it's just sports, but there's so many opportunities out there. Like I said, pediatrics, geriatrics, pelvic health, women's health, neuro, cardio. And so with all that being said, learning what we do as physical therapists and the vast variety of opportunities for physical therapists are great. And so if you educate yourself and learn it, and like I said, just Google it, just see what's out there, and that can help you understand if that's the path you want to go down. And lastly, research PT schools. Understanding each PT school is different and they have their different specifications, learning which prereqs they need to take and accept. As high school students, you can take college classes, so get ahead of the game and understand which schools you want to go to and which prereqs you want to take, okay? Some schools are more manual-based, some schools are more research-based. See which one you want to go to as well, and Texas has a lot of them. And so understanding where you want to go and what you want to do in the future is the best. As far as my contact information, I left it there on the PowerPoint. My email is siperez@dhr-rgv.com. The phone number there is for the office. If you have any questions, feel free to contact me. Shoot me an email or call and ask for Ziggy. I love to help. I love to talk about the profession. So if you have any questions, just let me know and we'll get in touch. Thank you. You have a wonderful day and good luck.